Hello, I'm Justin Gallagher, Associate Publisher of the American Journal of Managed Care. Welcome to This Week in Managed Care from the Managed Markets News Network. A study in the American Journal of Managed Care has put a price tag on the cost of waiting to see the doctor. Research led by Dr. Kristen Ray found that the cost of waiting for the typical doctor's visit is $43 when calculating travel and time lost from work. That's higher than the average copayment of $32. Nationwide, all that lost time adds up. The study found that the annual opportunity cost of waiting for healthcare was $52 billion. The study's senior author, Dr. Ativ Mehrotra, said the time spent per year by employed adults seeking medical care exceeded the number of annual hours worked by more than 500,000 full-time employees. For the full study, visit ajmc.com. Express Scripts announced this week it will add both new cholesterol-fighting therapies to its formulary after negotiating steep discounts with the drug makers. Praluent, made by Sanofi and Regeneron, and Repatha by Amgen, received FDA approval this summer for patients at high risk of heart attacks or strokes who have uncontrolled cholesterol even after trying the most powerful statins available. Both drugs have wholesale prices above $14,000 a year, which prompted Express Scripts and CVS to leave them off the formulary until they secured discounts. Express Scripts won't say how much they trimmed from the prices, but they estimate the new class, called PCSK9 inhibitors, will cost the pharmacy manager $750 million in 2016, well below projections. A study from the Virginia Cancer Center has found that between 40 and 50% of all endometrial cancers are caused by obesity, and that if more obese women were able to have bariatric surgery, many of these cancers could be prevented. The study followed 71 women who had surgery and lost an average of 100 pounds. Before their surgery, 10% of the women had precancerous uterine changes, which seemed to have been resolved by the surgery and the weight loss. The authors said the study adds to the evidence that bariatric surgery produces health benefits and cost savings in addition to better quality of life. The Department of Health and Human Services this week announced a proposal to simplify rules for providers who use electronic health records. HHS also finalized a rule setting standards for the creators of health information technology, which will allow systems to share more information and create more competition in the market. Dr. Patrick Conway, the Chief Medical Officer at HHS, said the new proposal is based on feedback from physicians, who asked that electronic health records be easier to use. Both proposals are designed to get the healthcare community ready for the 2018 goals for Medicare reimbursement, which call for 50% of all payments to be tied to value-based models. Lack of transparency in healthcare creates wide variation in what patients or their insurers pay for basic services. A study published this week focused on the variation in the cost of mammograms, a basic service for women. Researchers from Castlight Health found that the cost of a mammogram can range from $43 in Sarasota, Florida, to $1,898 in the New York metro area, a 44-fold variation in cost. The study's authors said their findings underscore complaints that the lack of transparency in healthcare pricing falls harder on women than men because women use more healthcare. Finally, it's not too late to register for our upcoming meeting, Patient-Centered Oncology Care, which takes place November 19th and 20th in Baltimore, Maryland. We'll hear new findings on the effectiveness of requiring genetic counseling with testing, and we'll learn about the impact of the FDA's increased oversight in molecular diagnostics. To learn more about the agenda and to register, visit our conference page at ajmc.com. For the Managed Markets News Network, I'm Justin Gallagher. Thanks for joining us.